But we're going to spend just a few minutes at the end of this first session before we come back to that, looking at the nuts and bolts, the foundations of the partnership. So I want just to remind everybody that the HRP was formed a year ago, led by Jackie Cassell and Malcolm, and built really on these 6 what we call foundation partners. So the medical school, its parent universities, the SPFT and University Hospital Sussex. And into this landscape came the structure of NHS Sussex we've just heard about, really, and focused very much on developing opportunities for shared research, infrastructure, capacity development and collaboration. I'd emphasise, although this is a partnership of these 6 foundation partners built upon their existing relationships, we view this very much as an open and welcoming partnership to everybody working in this space. And so you'll see I've listed on there some of the other key NHS and higher education partners from across the region that have become involved over the course of the last year. You have a partnership board you've heard about, chaired by Stephen, comprised of the founding partners, which provides strategic oversight, direction and assurance. This is very high level, as I say. So we've got the University Pro VCs for research. Stephen, you've heard about all the NHS provider, or the 2 NHS providers, CMOs, the Dean of BSMS, and also involves the NHR system partners, so the ARC, the CRN and the Academic Health Sciences Network. But beneath that exists what's really the engine of the partnership, which is the executive, which I chair and which brings in senior cross-partner input. So this is like research directors on the NHS side, senior academics from across the universities, the local authority leads I should have mentioned before now probably, and this is the group which sets the day-to-day agenda of the partnership, but also importantly tells the board what to do, so it feeds up and guides the board. I emphasise this because it's commonly asked as a question, well, why have we just got these 6 at the top, where's everybody else? But it's a genuinely inclusive partnership that clearly needs to be efficient and streamlined at the top. And third of all, we've got this Public and Community Advisory Board, which I'm going to talk a little bit of detail about in a moment or two, which inputs to the board, or will input to the board, and the executive work, and the development of that is very much one of the highlights of the first year, really. So the HRP focuses on health and care research, and it's just worth stopping for a moment to focus on what we mean by that. And this actually is the definition taken from the NIHR Be Part of Research website. So very broad, but very, if you like, right-hand side in terms of research development, very applied, very near to clinical practice. So research that answers questions about the best options available and uses these discoveries to make decisions and improvements or changes to diagnosis of disease, provide life-threatening treatments, prevent people developing conditions, improving health and care for generations to become, and ensuring everyone has a better quality of life. So that's the feeding on what Stephen said, that's very much what we are all about. The partnership is based upon 4 pieces of key infrastructure. We're going to just talk very quickly about each of these in turn. Some of it's listed for quite a while now. So the trials unit came into existence in 2016 and is about supporting researchers' study design, management, assurance, analysis, right way through to dissemination. The JCRO a bit more recently, providing advice and support, streamlining application study setup processes. We're going to hear in a few minutes about one of the 2 big things we've done this year, which is to establish this new research training hub, which provides academic career support for different health and care professionals. And then finally, although I'm going to talk about this first, about development of this public and patient advisory board. So, unsurprisingly, it was recognised right back in the beginning that the HRP needed really strong public and community involvement and engagement. But we didn't really know how to do that. And so we had a lot of discussions in the executive early on and agreed there was a need for strategic level public and community engagement in health and care research across Sussex, over and above a whole range of different PPIE activities that go on already across the other partners. We were able to do some initial work to scope and establish how this PCI input should work with the help of a charitable donation made at this meeting last year, or after this meeting last year, for which we are enormously grateful. That allowed us to hold a workshop in March of last year involving some active public members from across the various structures in the region. And I should also point out that we weren't the first people to come to this. There were at least 2 reports written by people who I think were probably in the room in the past about how the medical school and the system should do better with PCIE, and we drew upon that wisdom as well. We had a workshop in March that proposed the establishment of an advisory board that was approved by our board, and year one funding agreed. We did some further engagement across PCI teams from different partners and the ICS, and agreed that we would have a group which would bring together diverse voices and experiences to influence the strategy development, so what we're all talking about today, and its delivery. Also help contribute to setup and delivery of well-designed research. But a couple of other very important things: support collaboration and communication across this diverse PCIe landscape that exists already in Sussex, focusing particularly on community groups and underrepresented groups. Develop sustainable PCIe. There was a desire to produce a group which would be self-sustaining, both in terms of funding terms, but also fostering training, mentorship within the group, making sure there was a rich and diverse group of people coming into this space, and work to contribute to influence advocacy around PCIe research, both within the HRP but also beyond. And I'm pleased to say we've now made our first appointments to that advisory board, first 5 appointments. I think they are all here today. I'll be to meet them properly during the course of the day, and they'll be starting their work over the next month or so. But I wanted to finish by pointing out that we've already got underway with some significant successes in this space, which I think just illustrate really well how the partnership can help us do things that otherwise we would really struggle to do. So we were successful just a couple of weeks ago with a bid for £100,000 to NHS England's Accelerated Access Collaborative, so-called Research Engagement Network of calls. And this was led by Anne-Marie, who you can see is based primarily at SPFT, Jane Lodge, who's based primarily at the ICS, our own Virginia, who's based at HRP, and Viv Colleran, based at UH Sussex. So a real cross-partnership proposal, working with a significant organisation in the VCSE space called Trusted Developing Communities, who are actually going to lead this work from the community perspective. And that's going to allow us next year to set up a diversity in health and care research engagement network in Sussex, which will work with these grassroots organisations and the ICS and researchers to really develop proper diverse community input to our research. I point out we've also just had a bid considered and provisionally accepted by the hospital charity, the University Hospital Sussex Hospital Charity. We're looking to make a significant sustained investment in this space as well, and so they will also contribute on the back of the work we've done to this PCI Advisory Board's work, help us deliver some community science cafes, and help us with this programme to develop community research development. So lots of stuff going on in that space already. I'm going to hand straight over now to Wendy, who's going to tell us about the CTU.